Alright, good morning everyone. This presentation is for high school kinesiology students, and today I'm going to be talking about biomechanics and what it is. So I'll start with the definition of biomechanics, then I'll talk about some of the subjects involved, as well as the meat of the presentation, which are the 5 key jobs involving biomechanics. So those are number one, ergonomist, a personal trainer, a physiotherapist, biomedical engineer, a pedorthist, and I'll end off with a concluding remarks on the presentation and just some things to think about. So, what is biomechanics? So, when you look at the term biomechanics, you see two smaller terms in here. So, there's bio and then there's mechanics. The bio part of biomechanics is concerned with life, right? So, we think about the human body when you see bio. And then there's mechanics. So mechanics is now the physics part of biomechanics. So for example, looking at movement, kinematics, forces, you name it. Now, why is biomechanics such a big deal? Well, we know that it's a big area, popular area of study in kinesiology, because we're mainly interested in the human body. We're looking at internal and external forces that act on the body. So, for example, internal being like your muscles contracting inside your body, and external forces such as gravity or the ground reaction forces, of course. And then we look at injuries in biomechanics. So that's a big popular thing in physiotherapy and rehab. We study that in kinesiology as well. We look at, for example, acute versus chronic injuries, etc. More to be covered later. So now subjects in biomechanics. Of course, number one is math. You need to know how to calculate basic math in order to understand, to calculate what is force, moments of force, torque, and kinematic variables such as acceleration and velocity, etc. Anatomy, I would have to put a star beside that, and that's important because number one, it's a qualitative observation and analysis of, let's say, joints in the body. So, for example, we're looking at, okay, what ligaments and tendons are involved in this joint? Does it have enough support? Is it stable? And from there, by asking ourselves these questions, we can then determine, okay, how can this joint be challenged, and how can it be challenged to the point to what extent can we challenge it so we don't injure that joint, right? And then next is physics. So physics is where is the real quantitative stuff involving, for example, forces, velocity, acceleration, etc., things like that. That's very important. And then biology, also static and dynamic equilibrium. Then biology and physiology, that's almost like anatomy, but like it's talking about, for example, how does a knee injury heal or something, what cells or platelets are involved with that. And then engineering. So engineering is, again, depending on the job, maybe biomedical engineers may focus on how to make an artificial limb that kind of mimics the actual leg's function, but not fully. So now let's get to the interesting thing, the jobs involved in biomechanics. I'll start with ergonomists. So ergonomists, we know, are concerned about the safe and efficient design of equipment and tools to allow workers to kind of comfortably use those tools with minimal risk of injury to ensure a very safe environment, right? So some aspects of so how does biomechanics relate to this? Number one, we understand the ergonomists understand limits of the human body. So they may look at, they need to know their anatomy well. They'll look at the lumbar spine, the L4 to L5 joint, and maybe the wrist. So maybe for the lumbar spine, they'll look at shear and compression forces. Again, biomechanics is involving and helping them determine injury here. And with the wrist, they'll look at, for example, acute versus chronic injuries. So if somebody's repeatedly moving their wrist around, they may eventually, gradually, depending on the situation, get carpal tunnel syndrome, which leads to injuries of workers. So ergonomists also study that. They study, for example, carpal tunnel syndrome. They look at the carpal tunnel structure and the tendons and determine, okay, how much flexion and extension are needed so that the person injures their joint, and how can they avoid that? Which then gets into redesigning tasks and equipments. There are so many biomechanical considerations here because, for example, for a task, let's say somebody is to lift an object. If they obviously keep the box far away from them, and they lift that box, the moment arm from their L4 to L5 joint to that box horizontally is going to be large, which ergonomists would say that's going to be a great amount of force and a greater amount of strain on the back muscles. Whereas when they redesign this task, ergonomists might say, okay, what if they keep the box close to them and then lift it, because the moment arm is smaller, and thus they'll have a less strain, they'll have reduced risk of injury of the back muscles. But big idea, ergonomists are matching the tasks with worker abilities and strength. It's not the other way around. Now, the second job is a personal trainer. You and I have seen these people before in the gym. They're helping people achieve their fitness and exercise goals by teaching them how to use equipment, educating them on proper form, and how to reduce risk of injury, as well as assessing their strength. So, how does biomechanics relate to this again? Number one, they demonstrate exercise and equipment. Of course, personal trainers need to know their anatomy well. They need to know how much can you stress a muscle. They need to know the different kinds of equipment. So, for example, resistance training equipment, there could be different kinds of resistance. So, there's the free weights, the pulley weights, the accommodated resistance. There's also the hydraulic cylinder equipment with air, compression of air. And they have to know the difference between those equipment to find a better program suited for exercise program for their client. As well, they're monitoring client progress, so they're assessing their strengths. So, for example, different kinds of strength, different muscle contractions, such as how are they in concentric, eccentric, and isometric muscle contractions. They'll teach clients. Biomechanics involves the use it or lose it principle, which, for example, if you don't use a muscle, you'll kind of have it diminished. So that's what clients need to know, and this is helping personal trainers develop and train their clients for good fitness, as well as looking at strength curves. So personal trainers may also look at this. So involving the cam pulley, they'll look and to see, okay, which level of load matches this client, so that they can start from this load and progress to a higher load from that, as well as preventing risks of injuries. That's also important for personal trainers. That involves like the moments of force and everything as well, proper form. The next job is a rehabilitation, or physiotherapist. Now, these are people, again, we've seen them, that they help people recover from injuries, such as maybe from surgery as well, old age, and maybe a disability. So they kind of help people get back to, they help people to increase their strength and get them back to normal mobility and performing activities of daily living. Now, where does biomechanics come here? Number one, these people, physiotherapists and rehab people, observe normal versus abnormal structures. So again, they need to know their anatomy very well, and as well as observation of normal versus abnormal movement. That's where the physics and biomechanics comes into play. And this all comes to gait analysis, which is very popular. So they look at the way somebody walks. Maybe they say, okay, does this person have more valgus or varus in their knee? Maybe are they loading the medial aspect of their knee joint too much? And how is their foot? Like, is their foot absorbing too much load on the medial side? And just asking these kinds of questions. Forces, moments of force, even the ground reaction force. How is that affecting the moment of force at the person's knee and ankle? So is something compensating? These are the questions that guide the physiotherapist and biomechanics to assess the patient and make a diagnostic. The next thing is analysis of muscle activity. So this is a really important. They Physiotherapists also conduct myoelectric stimulation on the person, on the patient for therapy, and other therapies like electric stimulation therapy. They'll also look at the strength of the patient. So, for example, how much fatigue will they have? Are they really trying? Are they really exerting themselves when they're doing an exercise, or are they just rushing through it so that they don't have to do it? We can even look at EMG analysis of this. Greater fatigue, you'll see a higher EMG with that. Let's get to the job. So the next job involves a biomedical engineer. So these are people who actually combine engineering and medical sciences together to design and create equipment and devices that actually resolve medical problems. So I mentioned this earlier, but how the way biomechanics plays here is with anatomy. So for example, of course, and I'm saying it again, anatomy is a consistently recurring theme. They have to understand human anatomical structures. So, for example, how is the hip joint structured, so I can make a artificial hip joint that fits this patient. So they have to also understand how human body parts move, so that they can develop effective materials in their construction of the artificial joint that will help the patient biomechanically, which then comes to prosthetic biomechanics. So prosthetic biomechanics, again, involving concepts such as socket fit and design. the biomedical engineer has to make sure that their final product, the artificial limb, actually fits the patient's limb. Because again, there might be some neural damage. Of course, there's neural damage and muscle damage. The muscles aren't there anymore, so they have to think, okay, maybe do I need a motor? Is this person strong enough to actually move this artificial limb, etc. These are some things to think about, and as well as using gait analysis to adjust the prosthetics. So again, this is where biomechanics comes in. It's allowing biomedical engineers to actually use gait analysis to observe abnormalities in patient gait and the way they walk, so they can adjust the prosthetics in a way to give the patient a more comfortable kind of walk. The other job is a pedorthist. So the way it sounds, ped meaning feet, they are orthotic and footwear experts working alongside doctors to improve pain and activity levels of people with foot and lower limb conditions. So what I mean by this, some areas of focus of a pedorthist involve gait analysis. Again, it's a very popular thing. They use biomechanical motion analysis, so looking through cameras, putting different markers on different bony landmarks. So there may be the ankle, the malleolus, the rear aspect of the ankle joint, etc. To look at how whether there's a varus or valgus, or maybe a pes planus or pes cavus, caved in kind of foot. They make these observations and conclusions based on what they see. Again, this is how biomechanical technology is helping pedorthists to assess their patients. Now, the other thing with biomechanics is moments of force and ground reaction force. So with moments of force, I mean, for example, if the ground reaction force vector is pointing a certain direction after somebody lands their foot, maybe the pedorthist will ask themselves, okay, how is this patient's muscles reacting? How is the moment of force reacting if this ground reaction force is pulling in this direction? So they want to see the relationship between the moment of force and the ground reaction force moment in a patient as they're walking, to kind of compare and contrast between normal versus abnormal gait. The other things are analyzing abnormalities and structures of the feet. So again, I'm going to repeat again, anatomy is another theme here. And lastly, modifying shoes and orthotics. So now that the pedorthist has observed the patient's gait and looked at biomechanical parameters, they can then modify shoes and orthotics to kind of improve the overall walking experience for the patient. This involves concepts such as impulse and force. So maybe some shoes are designed so that there's a greater time to absorb the force. So in other words, more cushioning, and to absorb more force, or to allow the pedorthist may modify the shoe to allow a greater propulsion force in sport, for example. So these are some things there. Now, some concluding thoughts. Just to summarize our presentation, we talked a lot about different jobs and what roles they have and how biomechanics plays in those jobs. Many of the jobs share similarities. So a lot of them looked at gait analysis and also having a very strong knowledge in anatomy. That is what helps us compare abnormal versus normal movement, for example, and how we can innovate to help a patient medically. And then as well as studying injuries, like I said, this is very popular in rehabilitation, physiotherapy studies, and kinesiology, because we look at the mechanisms of injuries and how to prevent injuries. I find that gait analysis especially is a very big application nowadays, as many studies are using different kinds of technology to study people's gait. So, for example, they'll also use an EMG analysis to analyze muscle activation patterns of somebody's muscles when they walk, for example. Or they might also look at isometric strength using a Biodex isokinetic dynamometer machine. So there are many different applications and many ways in which jobs use biomechanics, and it certainly has helped us guide patients throughout their injury journey and help them recover from their injuries, as well as getting them back to normal living. I certainly hope this presentation helped and was very detailed and informative, and I wish all the students best of luck with their studies. Thank you very much.